Hi, guys, it's your favorite nurse educator, NP Clark, and I'm back with another cup of the morning coffee. In today's cup, guys, we are going to address part two of navigating the nursing home. So, part one, we covered preparation for performance, right? So now that we are prepared for our day, because what did we say we were going to do? Come to work on time, run our patient list, kind of see what kind of mix of patients we have, get our work area together, and kind of create some little lists, right? We want to know who our diabetics are. We want to know who's on Coumadin. We want to know what labs were run or maybe they need some follow up on, right? We want to know who has appointments. We want to know maybe someone went out on pass and they should be coming back today. If there's a listing of providers that are coming in, such as like podiatry or any things like that, so that way, as we're rounding, if some of the patients have some concerns about something, that they can be seen that day. And then, but another thing that I left this part out, but it's just as important. What aids are you going to be working with for that day? Whether it's restorative aid, respiratory aids, CNAs. Those people are very important because they usually know the patients better than you do. Well, not usually. They always know the patients better than the nurse. So, and that's not a knock at nurses, but it's the truth. They spend more time with them. They're doing more intimate jobs with the patients, and so they gain their trust a little quicker. So I used to always want to have all of the aides on my side and just work with them because they can make or break your shift. So now that we are prepared, and I've had a little meeting with the staff that I'm going to have for today, because that is one of the first things you want to do. And when I say little meeting, it may just be writing out a schedule and putting down, hey, this is where you're going to be, because that really is where what we've gotten away from, the nurse doing the assignments. So you are running the floor. So that is what you're supposed to be doing. Making the assignments, and even if you allow the staff to self-assign, that's fine too, but you need to know who's responsible for what. Because at the end of the day, what do we know about delegation? It still comes back on you as the delegator, right? You are still responsible, even if someone else was told to do it. It still comes back on you, because that is a key component of delegation, is ensuring that you circle back to make sure that the task is actually completed. Showers, nail trimmings, getting somebody prepared to go down to dialysis. Those are all things that I'd like to have on my schedule for that day, just so that way I kind of know what my day is going to entail. And there may be some things that I can kind of couple over here to do, and then some other things that down here I may need to push over to the side. So our next step is really prioritizing, right? So I want to know, as that nurse that's coming in, and maybe I'm working from the agency, but in regards to labs, how many labs do I have that are right there available for the patients that I'm assigned to? And sometimes, depending on who I'm working with, or if I feel like I'll have some time, I just get all the labs, and I even tell the other nurse, hey, I'm going to take care of these labs, but can you do this? And it's just working in a partnership if there's more than one, nurse on the floor. But neither here nor there. I will get the labs together, and I look and I divide them by physician, provider, whoever I'm going to be calling. And then I put the call in, and I kind of leave a message with not only the front desk of the facility, so they know I'm the one who called, but also in the message to the provider, I'm looking for them to call me back. Hey, I've got some labs to relay, blah, blah, blah. No criticals, highs or lows. However, I do need to, there are some abnormals or whatever, just something brief. So that way, I as a provider also can kind of gauge, do I need to call you back right now? Or is this something that can wait a little longer because I'm really doing something else, right? And it's kind of like a back and forth. You learn the providers and they learn you, and they learn, hey, if this person is telling me, hey, this is something you need to call me right back, you're going to start getting that trust built, right? So then I let the other nurses on the other floors kind of know, hey, I called this physician to relay labs, so, let me know if you need to speak to them. So when I'm finished, I can just tell them to hold on and page for you to pick them up. Another thing, after that, for me, it was always very important because Coumadin is one of those drugs that you have to stay on top of it. I always wanted to know who was on Coumadin. If I have a new CNA working with that patient, I want to educate them to know that, hey, if you're brushing this person's teeth and there's blood, you need to let me know. Is it something they should be telling you anyway? Yes. But at least this way there's a reason, because maybe the patient says, oh, that happens all the time. So when they're reassuring you that it's not a big deal and that the nurse knows about it, then sometimes you get people that, and I'm not going to say that this is all the time, but sometimes they're just kind of like, or they do tell the nurse, but the nurse is like, oh, it happens all the time. So I want to know who my Coumadin patients are. I want to know the patients that have multiple blood pressure medications, so that way I can get a good reading on them before I administer these 4 blood pressure pills, right? I want to know who are the diabetics, so that way I'm not doing an AccuCheck and administering insulin, and the kitchen now is telling me the tray is going to be 45 minutes late, but I've already administered the insulin with no snack to this patient, no juice, no nothing. And not educating, again, those aides to kind of help out, right? So, and I forgot activity aids. I don't want them to get upset. Activity aids, they are good, give good resources and helpers as well. So now again, now I'm starting to roll with, okay, it's medication passing time. So as I go to start doing my medication, I always used to like to get all my insulins out of the fridge or wherever they're keeping them these days, but get them out of the fridge, make sure that everybody that is on my list has their proper medication, so that way I'm not doing this running back and forth game. If I have done rounds and realize I'm going to have to change a G-tube feeding that's hanging, make sure I have it on my cart. That way it's a one-stop shop, right? If I have patients with eye drops or inhalers, looking for all of those things. And the reason why I keep my little list of patients is so I can make notes as I go along. This patient's eye drops is out, or they're low and they need to be reordered. And then I just make a note, so that way when I do get back to the desk, I can sit down and properly go back through my list. And we know what happens as you're out passing the medications. What happens now? The provider has decided to call you back, and they're impatient, because I know I am. I've got all these people calling me. So I put a little note. Hey, here's the lab, or I have the lab there on the cart with me. So that way, but I've also gone through the labs. Like I said, this is a potassium. Is the patient on potassium? This is a Coumadin. Here's what the INR was. Well, PT and the INR, but the INR is more important for me. What is the current dose? When was the last time this PT INR was drawn? Are there any things going on with the patient? Is the patient on dialysis? Are they on a blood thinner? This, that, and the other. Like, even when you're calling about a fall, you should be looking at, does the person take multiple blood pressure pills? Where did the patient fall at? Are they on a blood thinner? All of these things are important in the story, and considered for you to be relaying something. Because I think we've gotten away from the true meaning of relaying. Now a lot of the staff, when they're calling, they think it is just reporting the bare minimum, and then you go do your own research. But the truth is that is not you relaying anything to me. So that's the reason why I ask a lot of questions, because I need to get a picture of what's happening. You are the person that's there. So there's a lot of patients in these facilities, and heck, I even have patients in different facilities with the same name. So that's why it's also important for you to identify who you are, identify the patient, identify what's going on with the patient. What facility are you calling me from? Maybe even tell me what floor you're on, just in case I can't hear the name of the patient or your name. But either way, but it's just, again, back to that preparation for your performance. And now that we're performing, we want to perform efficiently, right? And in performing efficiently it's all about that preparation. making sure that I have all of those supplies, have my water pitchers filled up, make sure I have enough cups, the little smashers. I don't know if we still use those, but the little smashers for the medications and things like that. Having all of those things that we need right there. So that way, again, it's not back and forth, back and forth, back and forth. Having a couple of sheets of paper and specifically your assignments, so that way you know who's doing what at any given time, and your roster of patients with your little notes on it. So, and I say little notes because generally you're trying to fill up a whole page, so they're literally little. But however you like it to go, but that preparation, again, is for you to be able to work efficiently. So the word for this video is efficiency. So this way, when the provider calls back, I've got all of the labs for that provider in one pile. So I don't have to call back 4 or 5 times, because guess what? After that second call, those calls are going to get, the wait times for the return call is going to get longer and longer and longer. So why do that when you could just have everything together, right? Now, let's say a patient went out on an appointment. I want to have something together to show that, okay, this patient went out to an appointment, and this is the type of appointment that they went out to. A